in supervision, you are constantly in the balance between the functional, administrative aspects of supervision, and that is timesheets, whether somebody gets their documentation in on time, whether they sign their name and put their credentialing in a legible way. I mean, right, give me some others. Whether they wrote in black pen, right, all of that stuff. And then there is the professional development aspect, which is who are you as a social worker, who are you as a practicing professional, who are you as a human being, and how do we have this relationship in which I'm mentoring and collaboratively partnering with you to help move you to a place of greater sophistication and advancement. It's a constant battle, and only when you are in a, so let's say, a private practice group supervision situation in which it's much more collegial, you have that relatively minor, if at all, administrative expectation of that supervision. Most other supervisions tip disproportionately the other way. They expect it to be, it's really hard, I don't know for you, but for me, what I have to say in certain supervisions, we are not going to talk about administrative stuff today. So don't ask me about, timesheets, and don't ask me about schedules, and don't ask me about this. We're going to talk about this case. We're going to talk about this theme. We're going to talk about this thing. We have to structure it because the administrative demands of the complexities of what we do easily soak up all the time. One of the things that we're seeing in the psychotherapy profession as a key variable is not only attending to outcome, which has, of course, been going on for the last 15 years or so, but also healing the healer, and that is making sure that an important part of the profession is making sure it's self-care. And I'm using it in my supervision regularly in teaching new therapists how to not get burned out, how to protect themselves from vicarious exposure, how to make sure that as an early part of the infrastructure of their professional development, that they are learning that you will be affected by this. And you just have to mitigate as much of it as you can, and you have to do as much harm reduction as you can. But don't kid yourself. But if you're exposed to 5,000 traumatic situations in the course of the decades of your practice, you are going to be affected by that negatively. The quality of your life will be. And so what are you doing to protect yourself? What I'm also continuing to emphasize wherever I can, in particular with my supervisee, if you are an LCSW, you are an end-level practitioner. And we have 5 decades of practicing as end-level practitioners in the behavioral health, social service, human service field, and we need to make sure we hold our ground. We lost a little bit of ground in the 90s, in the 2000s, because other professions started coming back in. We're regaining it again. And sometimes it's at the expense of some of the other professions, but there are ways in which carrying ourselves and remembering, and when you see social work diluted down, take it as your personal mission to remember that it's not, as I said, case management, or it's just not one of those warm and fuzzy folk. We're evolving as a profession, and we are not just case managers or psychotherapists, we are social workers. And how do we make that part of the legacy that we pass on to the people that we're supervising, for them to remember who we are and the proud heritage that we have. I mean, we have a heritage of caring and human endeavor that is unique among social service and behavioral health. And so we should be proud of that and remembering it and continuing to embrace it as we go.